healthy life. Okay, that's the first one. Okay, then you have to go to a dermatologist or a plastic surgeon and make sure that he or she is a board certified. That means that she had a 3-year training. Okay, and then you look at the certificate on the on the clinic just to make sure. And then before you go to that doctor, you ask around. Okay, you ask your friends if you've been to this doctor, and just make sure that she has no complications. She has a good track record. Okay, and also make sure that you follow up if you go to your doctor. All right. So live live better, feel better, look better, forever like us.
Thank you very much, Dr. Ferraris. Dr. Cruz.
For me, since I'll be talking to the general public, no, kasi kayo yung media, you will be the mouthpiece. Gusto lang namin, what we want to say is that if you go to a plastic surgeon or a dermatologist, you should have realistic expectations. Okay? Hindi nga yung Johnny Depp, dala mo yung magazine ni Johnny Depp. Hindi pwedeng ganon. You should have realistic expectations. And as mentioned before, you engage your doctor. You talk to your doctor, you ask questions. Okay? And now there is a proposal that for any cosmetic procedure, there should be a lag time of 1 week. Anong ibig sabihin nun? Meaning the patient comes to me now, Doc, gusto ko breast augmentation. That procedure cannot be performed immediately, tomorrow, mamaya, sa isang bukas, hindi pwede. It has to be performed 1 week after. So that the patient can have time to think, can have time to seek the opinion of other physicians, maybe have his preoperative evaluation, preoperative evaluation done. So that's still a proposal. And all this will, the end in sight really is for patient safety. Kailangan safe po lahat. No? And then more so with cosmetic or plastic surgery. It has to be safe because our margin for error is practically zero. Because these patients are normal patients, they are not sick, they just want to look good. Therefore, we cannot commit mistakes. So yan ang very important. And we need the cooperation of the patients for this. Hindi pwedeng may itago sa amin. Kailangan sabihin sa amin lahat.
Thank you very much, Dr. Chan.
The topic before, some patient come into my office and take some picture and say, I want to be this. Just like a movie star, just some famous actor or actress. I don't know if you know Angelababy in Hong Kong. Yeah, whether that in Hong Kong. So many Taiwanese want to be, many Taiwan girls want to be Angelababy, and they take a picture to my office. And that is impossible, you know. So I tell my patient, okay, you have another way. You can choose Photoshop. You know, Photoshop and the plastic surgeon OPS. Yeah, so that's the same. Okay, in summary, if you want to look younger and beautiful, the most important thing is to be happy to pay. Okay. Thank you.
Thank you.
Okay, of course, from the psychiatric point of view, I'd like to play a little bit of a devil's advocate. You know, when they would come to us, when they were be referred to us, and they say they want to look like this, we try to map how far they can actually achieve it. You know, as psychiatrists, kasi we have this high tolerance for crazy, you know. For us, for some people, they think they're crazy, but for us, actually, pwede pa yan. One best example is that there are performers who actually use cosmetic surgery to look like a certain actor or actress. So if that is something in that mind, that doesn't necessarily disqualify them. But they have to, as what Dr. Cruz has mentioned, have realistic expectations. They can never be the same as Johnny Depp. They can try to look as close to Johnny Depp, maybe like as Captain Jack Sparrow, but not as the Johnny Depp you would like to look. No? And more importantly, they're right, no? Beauty comes from within, but it doesn't mean that you have to keep it within. You can bring your inner beauty outside.
Thank you very much, Dr. Alejandro. Dr. Suna.
Okay, I think most of our fellow doctors has just mentioned everything. But to close this, life I think must be enjoyed overall. Whatever you want, whatever your expectations, as Dr. Cruz mentioned, as Dr. Elipanio mentioned, realistic expectations. But overall, I think if you really want to look good, or whether in and out, whether it's about aesthetics or something, I think it's a matter of choice. It's a preference. With all the available resource, right doctor, right treatment, right product. These 3 R's would bring you somewhere and will make you, again, live better, feel better, and look better. With that said, thank you so much.
Thank you very much to our distinguished guests, to our distinguished